Hi, my name is Megan. Today I'm going to be discussing the exam of the upper extremity from the shoulder to the tips of the fingers. This is Andrew. He'll be my simulated patient today. The first thing I'm going to do is I'm going to wash my hands as I enter the room with hand sanitizer, and I'm going to introduce myself to my patient. So I'll say, hi Andrew, my name is Megan. I'm going to examine your arms today.
Hi.
This is Nora. She's not helping. So I'm going to try and get some background on my patient. So I'll ask, do you have any pain that brought you in today? No. Have you had any issues with your arms or your joints? No. Do you have any medical history? Have you been around anybody that's sick lately?
No.
No. Do you take any medications?
No.
Do you have any allergies? No. And then I'm going to ask about his occupation and his hobbies, because that could clue me into some potential problems. So what do you do for a living?
I'm an engineer.
Okay. And what do you do for hobbies?
I play soccer and I work on my car.
Okay, good. So I'll keep that information in mind. And I'm going to begin by inspecting both arms. I'm going to roll up his shoulders so that I can actually see. In a real clinic setting, I would likely have him take off his shirt, but I won't do that to him today. So I'm going to inspect both arms. First, I'm just going to look at his skin and see, are there any rashes or lesions, any cuts, any signs of previous surgeries, any redness or swelling. They both look equal. I'm going to have you flip your arms over so I can inspect the other side. Good. And I don't see any of that here either. Then I'm going to inspect for any swelling throughout. I'm going to look at the alignment of his joints. They all look appropriately aligned. And any visible masses or anything like that. I'm going to then inspect his range of motion. So what I'm going to do is I'm going to ask you to move your shoulders first. You're going to go into full extension. Good. Should be about 180 degrees. And then you're going to go back into flexion. Put your arms behind you as far as you can. Good. And then we're going to look at the adduction in his arms. So bring each arm across your chest. Good. And he should go across to about 50 degrees. I'm going to assess the range of motion in his elbows. So we're going to do flexion and extension. So put your arms out like this. Bend up and back down. Good. So he should be able to go to about 180 degrees there. We're going to assess his pronation and supination. So put your arms like this. Rotate them in and out at the elbow. Good. You should be able to go between 90 degrees there. We're going to assess the wrists next. So you can flex and extend your wrists just like that. We should be going to between 90 and 70 degrees. And then we're going to assess ulnar deviation. So put your hands out flat like this and rotate them in like that. Good. Ulnar deviation should be about 55 degrees and radial deviation should be about 20 degrees. We're going to assess the fingers, so I'll have you move them all up and back like that. Spread your fingers out and rotate your thumbs. Do you have difficulty or cracking with any of that movement? No? Okay, good. I'm going to assess the joints for crepitus. So starting at the shoulder, I'll have you rotate around. Good. I don't feel any crepitus there. The elbows, I'll do the same thing. Good. And the wrists, I don't feel any cracking or crepitus there. And the fingers, just move them all around. Good. Next, I'm going to assess the strength in the upper extremities. So I'll start at the shoulders. We're going to do a shoulder shrug test. So shrug your shoulders up against my hands. And he has good strength there. And then put your arms out straight in front of you. Pull up against my hands. Good. Don't let me push your arms down. And then push down against my hands. Don't let me push your arms up. Good. And then we're going to assess the forearm strength. So you can put your elbows up at 90 degrees and push against me. Good. And don't let me push back. And then same thing, pull. And don't let me push back. Good. Got good strength there. And then we're going to assess the hand strength. So you're going to push your hands up against my hands. That. Yep. And then push down. Good. And then same thing with the fingers. Up. Good. And the thumbs. Good. He's got good muscle strength throughout. I don't see any areas of asymmetry or weakness. Next, I'm going to palpate his pulses throughout. So I'm going to start with the brachial pulse. And I'm going to feel the other side. Good. They're both +2 and equal. I'm going to move down and feel his radial pulses. Good. And again, those are +2 and equal. I'm going to assess his capillary refill in both sides. So I'm going to take one finger and squeeze until the skin blanches. Release and check the refill. So that was less than 2 seconds. And do the same thing on this side. Assessing for his pulses, capillary refill, temperature is all part of a cardiovascular exam. I'm assessing his perfusion and his cardiac output. No cats allowed in the office. Any signs of poor perfusion could be related to a cardiac issue, or he could have Raynaud's syndrome, for example, if he had blanching or cool extremities in his fingers, which is a spasming of the vessels. Next, I'm going to assess his sensation. So you'll close your eyes, flip your arms over, and tell me when you feel me touching.
Yep. 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 Yep.
Good. And I'm going to assess his reflexes. So I'm going to start here. I'll have you just sort of relax your elbow, your arm into my hand. I'm going to start by assessing the reflex in his elbow, which is C7, related to the cervical spine. If he had any hyperreflexia here or diminished reflexes, it could be related to a neurological problem. I'm going to assess both sides and check for symmetry. So there's the elbow. Okay. On the other side, I'll have you kind of do the same thing. Just relax into my hand. Good. And I'm going to work my way down the arm and assess the biceps brachii reflex. So again, relax your arm into my hand. Good. And I'll do the same thing on this side. Again, relax your arm. Good. And next I'm going to assess his brachial radialis reflexes, which is related to C6 in the cervical spine. Good. And the same thing on this side. Good. Both reflexes are equal. There's no hyperreflexia there. And then 2 potential problems that he could have based on his hobbies and occupation. He could have carpal tunnel syndrome because of using a computer. Carpal tunnel syndrome is caused by repetitive small movements of the hands and wrists. So I'll screen him for that. The test for carpal tunnel syndrome is Phelan's test, as well as the 2-point discrimination test. So Phelan's test, I'm going to ask you to hold your hands like this with the backs of them together and push them together. You can hold that for up to 1 minute. A positive finding would be numbness in the thumb, index finger, middle finger, and the medial aspect of the ring finger. So hold that for a moment. Do you have any numbness or tingling? No?
No.
So that's a negative finding. And then I'm going to do the 2-point discrimination test. So I'll have you flip your arms over on the table, close your eyes, and tell me if you feel 1 point touching you or 2.
2. 1. 1. 1. 2. 1. 2. 1.
Okay, good. So he was correct with all of those. So that is a negative finding for carpal tunnel syndrome as well. The other issue that I'd like to assess him for, because of his hobbies, working on a car and doing sports like playing soccer, is a rotator cuff injury, which can come from repetitive movements of the shoulder. For example, if he were laying under a car using a wrench, or if he were painting a ceiling and moving his arm like this. It also can come as a sudden injury from sports like playing soccer. The test for a rotator cuff injury is going to be the arm drop test. So I'm going to have my patient stand up. And I'll explain the test to him. So hold your arm up like this. I'm going to support your arm. When I let it go, I want you to slowly drop it down to your side as controlled as you can. Okay? Good, and we'll check the other side. Good, and he had good control of both arms. A positive finding for the arm drop test would be the arm quickly dropping down to the side without any control, or kind of bobbing back up. The treatment for carpal tunnel syndrome would include potential splinting of the wrists, NSAIDs, steroids, or surgery in a severe case. Carpal tunnel is most often seen in women. It's less often seen in men. It can be seen in pregnancy or people that work at a computer all day. Treatment for the rotator cuff injury could be ice, rest, NSAIDs, or potential surgery if it were an acute injury. PT and OT would also be helpful for both of those injuries. Prevention for both of these things include proper ergonomics. So I provide my patient with some education on how to set up his computer at work, making sure that his wrists are supported while he's typing, taking breaks, and using proper posture to avoid overextension when he's working under the car, and just being aware of those issues and bring it to medical attention if they do come up because of his occupation and hobbies. At the end of the visit, I would ask my patient if he has any questions. Do you have any questions?
No.
No? Okay, and then I would provide him with an after-visit summary and contact information for if anything comes up. That concludes our exam for today. Thank you.